My presentation is actually an educational session about combination of chemotherapy and checkpoint inhibitors versus checkpoint inhibitors alone. So there's a lot of trials that have been published in the past few years, but we don't have any study that has been published showing whether patients that have a high PD-L1 expression in their tumor should be treated with checkpoint inhibitors alone or with checkpoint inhibitors and chemotherapy. So what I did in my presentation, I reviewed all the data available and I compared the trials, even though we shouldn't technically compare across trials because the population is slightly different between one study and the other, but just to have an idea of what we have available now in the market and the outcomes that each combination provided. And one thing that I didn't mention, but that is very important, is there's an ongoing national study here in the US, and I'm not sure if it's open also outside the US, that is called the INSIGNA study that is comparing checkpoint inhibitor alone versus checkpoint inhibitor and chemotherapy for patients that have a PD-L1 expression in their tumors. And hopefully with that study, that is a prospective study, interventional study, we'll have the answer what we should do. Having said that, last year, Solange Peters, she presented data at ASCO 2020 showing that from a observational study with over 500 patients from a database called Flatiron, if you give checkpoint inhibitors alone, it seems to be just as good as giving chemotherapy in patients that have this high PD-L1 expression. So it is possible that a few years from now, we won't be having this conversation that we don't know what to do. That is the case today. And for patients with high PD-L1 expression, we would just use checkpoint inhibitors because they confer very good outcomes and patients have way less side effects. The infusion time is much shorter. So they feel like they can live their lives without that side effect that chemotherapy sometimes has. So that would be amazing for patients as well. Also, some of the checkpoint inhibitors, the schedule timing is changing as companies are allowing for us to give higher doses and allow patients to stay off, not off of it, but have in between sessions, like a time that is longer than just 3 weeks, or 2 weeks, like used to be with some drugs. So now we can give once a month or every 6 weeks, which is much more comfortable. But the whole idea of this educational session was just to provide a summary because we had so many approvals in the last years and we had some even last year. So just to give overall review of the data so providers know what the options are. And to be honest, all the options are very comparable. Like I said, we shouldn't compare cross-trial, but if you put the data next to each other, there doesn't seem to be one chemotherapy combination and one checkpoint inhibitor combination that is superior to the other. So it's really a personal preference and also side effects that some drugs can confer versus the side effects of the other drugs.